Dr. Marissa Joseph again. This is your module on urticaria. I have no relevant industry disclosures. So by the end of this module, you should be able to describe the clinical features and presentation of urticaria. You should be able to define what makes urticaria acute versus chronic, and you should also be able to list the potential triggers of acute and chronic urticaria. So again, in dermatology, we go back to our morphology, and we see this young individual with these swollen edematous red papules. So when we look at what term we would use in morphology to describe these lesions, we could call them papular, we could call them edematous or swollen, we could call them vesicular, but again, those are those small fluid-filled lesions. We could call them target lesions, or we could call them both papular and edematous, which is what we will call them. But let's contrast these different morphologies so you can see how they look different. So when we look at the picture of our patient with the swollen edematous papules and compare them to the vesicles, you see that the vesicles are very small, pinpoint, fluid-filled, clear bubbles. All right, and so when we compare our edematous papules on the left to the lesions on the hand on the right, we see that these are sort of three-ringed sort of target-looking lesions. Those target lesions are quite different. We see these target lesions in a condition called erythema multiforme, which is not urticaria. There are three features of urticaria that we should consider. Number one, that urticaria is largely known as hives. Number two, urticaria represent IgE-mediated skin disease. And number three, urticaria, each individual lesion lasts less than 24 hours. This is a very important feature on history. So when we talk about urticaria, we know that it's a vascular reaction of the skin characterized by a wheal, so again, the swollen edematous papule, with a flare response, an area of redness surrounding it. It's extremely itchy, and the most important point again is that individual lesions last less than 24 hours. Urticaria is caused by swelling of the upper dermis, and up to 20% of the population experience urticaria at some point in their lives. So how do we define acute urticaria? Well, acute urticaria is defined as less than 6 weeks duration. So multiple episodes of urticaria, but lasting less than 6 weeks. There are many different causes, but the most common cause is really idiopathic or no identified cause. In children, the vast majority of acute urticaria is caused by upper respiratory viral infections. It can also be caused by parasitic infections, by streptococcal infections. Food reactions such as with peanut allergy or shellfish are much less common. And we also see it in the hospital in IV administration of blood products, contrast agents. Chronic urticaria is defined as multiple episodes of urticaria occurring over greater than 6 weeks duration. And again, there are many causes that we can consider. There are physical urticarias, which are actually quite rare. There is cholinergic urticaria, which is triggered by heat and emotion. So often people who say that they get hives when they work out would have a version of cholinergic urticaria. There's cold, heat, and water urticaria, or even pressure urticaria. When the sole cause of a patient's urticaria is a physical factor, that's when we call it a physical urticaria. Chronic autoimmune conditions such as lupus can also present with chronic hives. So when we see a patient who has chronic hives, but also features of maybe perhaps a systemic illness, we would consider something such as lupus and investigate accordingly. Other things that can present with chronic urticaria are infections such as hepatitis, and again, human immunodeficiency virus. Dermatographism is a common party trick that many people can do. It affects about 2 to 5% of the population, and what happens is there's sharply localized edema or a wheal and flare response within seconds to trauma to the skin. So you rub the skin in a particular pattern and the skin will actually swell in that particular pattern. This is commonly associated with people who have chronic urticaria. So in terms of general treatment principles, we remove the trigger. So whatever the person may be allergic to, we remove that. The second is to investigate for underlying causes, especially if it's been going on for greater than 6 weeks. It makes us think that this is chronic urticaria. We use antihistamines to help for symptomatic relief, and there are even biologic therapies available for extreme refractory cases. So the key messages are that urticaria present with edematous papules as a result of a wheal and flare response. Urticaria can be acute, less than 6 weeks duration, or chronic, greater than 6 weeks duration. But again, each individual lesion of urticaria lasts less than 24 hours. And upper respiratory infections are the most common cause of urticaria in childhood. So by now, you should be able to describe the clinical features and presentation of urticaria. You should be able to define acute and chronic urticaria, and you should be able to list the potential triggers of acute and chronic urticaria. This is the end of your module. Thank you for your attention.